Here's a number most people over 50 have never heard. The 2020 Lancet Commission on Dementia lists midlife high blood pressure as one of the top modifiable risk factors for dementia worldwide. Not memory games, not crosswords, blood pressure. And yet most adults still treat hypertension as purely a heart problem. By the end of this video, you'll know exactly why that's a dangerous mistake. Here's something most cardiologists don't explain clearly to their patients over 50. In many people, high blood pressure starts damaging the brain years before it causes any noticeable problem in the heart. You can walk around with a blood pressure of 145 over 90 for an entire decade and feel absolutely nothing in your chest. No shortness of breath, no pain. Your EKG at your yearly checkup can look perfectly normal. And during that same stretch of time, thousands of tiny arteries inside your brain may be getting quietly damaged every single day, with every heartbeat. This isn't alarmism. It's what research has been showing for at least 2 decades. And it became even clearer in 2019 when the Sprint Mind study published in JAMA found something important. Controlling blood pressure more aggressively significantly reduced the risk of mild cognitive decline in older adults. For anyone over 50, this completely changes the way you should think about blood pressure. Blood pressure isn't just a heart issue. It's, maybe before anything else, a memory issue, a thinking issue, a question of how long your brain is going to keep working the way you're used to. In this video, I'm going to walk you through exactly how this silent damage happens, the subtle signs that can show up long before any heart problem, and 3 concrete things you can start doing this week to protect not just your heart, but your brain too. To understand why the brain takes the hit before the heart, you need to know about an anatomical difference most people have never heard of. The heart deals with high pressure using big muscular arteries, like the aorta, which has thick elastic walls designed specifically to handle heavy-duty pumping. The brain, on the other hand, depends on a network of tiny arteries and arterioles, thinner than a strand of hair. They thread through every region of brain tissue to deliver oxygen. Think of it this way. Picture your circulatory system as a city. The big arteries in your chest are like main avenues with reinforced pavement, built to handle trucks rolling through all day long. The small arteries in your brain are like the narrow side streets of an old downtown, functional but fragile. Now, what happens if you send a 30-ton truck down one of those narrow side streets every single day? For years, the pavement cracks. The road gives way, even if nobody notices in the moment. That's exactly what chronic high blood pressure does to the small arteries of the brain. Doctors call this condition cerebral, small vessel disease. And the National Institute of Neurological Disorders and Stroke has a whole body of literature on it. Over time, these tiny arteries thicken, stiffen, and in some spots, they clog completely. Every time that happens, a small area of the brain loses its blood supply. These micro-injuries, added up across years, show up on MRI scans as white spots on the brain, what radiologists call white matter hypertension. And here's the part almost no one over 50 catches in time. These brain changes start showing up in adults with high blood pressure years before any sign of trouble in the heart. Both Harvard Health and the Cleveland Clinic have published on exactly this pattern. It's also why the Lancet Commission on Dementia, first published in 2020 and updated again in 2024, listed midlife high blood pressure as one of the top modifiable risk factors for dementia. In plain terms, your cardiologist may tell you your heart looks fine, your EKG can be totally normal, and your blood pressure can still be slowly eating away at your brain. And here's what makes all of this even more serious, what almost no one over 50 spots in time. The first signs of this brain damage don't look like symptoms. They look like normal aging. I'm going to show you exactly what to watch for in just a few minutes. And just so you know, every study and source I'm mentioning today is linked in the description below. the Sprint Mind study published in JAMA, the 2017 American Heart Association Guidelines, the Lancet Commission's Dementia Report, and the Cleveland Clinic's material on small vessel disease. If you want to read anything for yourself, the links are all down there. Now let's get to what matters. 3 things you can start doing this week. First action: measure your blood pressure at home the right way. The reading you get at the doctor's office is, in most cases, the worst possible reading. There's a phenomenon called white coat hypertension, where your blood pressure spikes just from being in a medical setting, and another one called masked hypertension, where your reading is normal at the office but high in real life. The American Heart Association now recommends that adults with risk factors check their blood pressure at home on a regular basis. Here's how to do it right. Get an upper arm monitor, not a wrist one, that's been validated by the AHA. Sit in a chair with your back supported, feet flat on the floor, arm resting at heart level. Stay quiet for 5 full minutes before you measure. Take 2 readings, 1 minute apart, at the same time of day. Ideally once in the morning and once in the evening for a full week before your next checkup. Second action: know what your target blood pressure actually is for your age. This is where things have really shifted. The American Heart Association guidelines, updated in 2017, set the bar at 130/80, meaning anything above that now counts as high blood pressure for adults, not the old 140/90. For people over 65, the general recommendation is to stay under 130/80 when possible, in conversation with your doctor, because in older adults, blood pressure that's too low carries its own risks. The Sprint Mind data suggests that older adults who keep their top number, the systolic, close to 120 have a reduced risk of mild cognitive decline. That doesn't mean you should lower your blood pressure on your own. It means you should have this specific conversation with your doctor, with real numbers in hand. Third action: pay attention to subtle cognitive signs. The signs of small vessel brain damage look nothing like the dramatic symptoms people picture when they think about dementia. They're small. They're things you'd easily chalk up to, "I'm just getting older." Taking longer to find words in conversations that used to flow easily. Feeling like your thinking has slowed down a little for no clear reason. More difficulty doing 2 things at once. Small balance issues without having actually fallen. Feeling more mentally drained after simple tasks. No single one of these signs means you have small vessel disease, but if several of them show up at the same time in someone whose blood pressure isn't well controlled, it's worth talking to your doctor about getting an MRI to look into it. Harvard Health and the Cleveland Clinic have both written about this exact pattern. Now, a few important things about when to get medical help right away. Head to the ER if you have a blood pressure reading over 180/120, along with a severe headache, blurry vision, trouble speaking, weakness on one side of your body, or sudden confusion. According to the Mayo Clinic, those are signs of a hypertensive crisis, and at that point, the risk to your brain is no longer silent. It's an emergency. And about what not to do. Don't stop any blood pressure medication without talking to your doctor first. Stopping abruptly can cause a dangerous spike. Don't trust isolated readings. Blood pressure fluctuates throughout the day, and one high number doesn't mean you have hypertension. Don't try to lower your blood pressure quickly on your own. In older adults, especially over 75, bringing blood pressure down too fast can cause dizziness, falls, and in some cases, actually reduce blood flow to the brain. For anyone who already has kidney disease, peripheral circulation problems, or who's being treated for an arrhythmia, any blood pressure adjustment needs to be talked through with extra care. If you only take 2 things away from this video, let them be these. First, blood pressure isn't just a heart problem. For a lot of people over 50, it's a brain problem first and a heart problem second. Waiting until you feel something in your chest before taking it seriously can mean missing an important window to protect your memory. Second, measuring your blood pressure at home regularly with the right technique. That's probably the cheapest and most powerful thing you can do to protect your memory over the next 20 years. The good news is that the brain is more resilient than we used to think. The Sprint Mind research and the most recent Lancet Commission report both show something important. Getting blood pressure under control, even after 60, still reduces the risk of cognitive decline getting worse. It's not too late, but it does start today. If this video helped you see something in a new way, consider subscribing. Here at Health HQ 50+, we talk every week about this connection between heart health and brain health, always grounded in real science, never in miracle promises. And as always, every source is linked in the description so you can verify it for yourself. In the next video, I'm going to show you how sleep affects your blood pressure in a way almost no cardiologist explains during a regular appointment, and what that means for anyone in their 50s, 60s, or 70s. Thanks so much for sticking with me, and I'll see you in the next one.